Hello everyone, how are you all? Hope you all are doing great and smiling the way these cuties are. Welcome back to another interesting video of 15 different MCQs of Prometric series from Nurses, the Heart of Healthcare. Keep learning, keep growing. My name is Shanaz and this video is going to be of great help for all those aspiring nurses who are working hard to get their MOH, DHA or HAAD license to work in Gulf countries like Saudi, Bahrain, Oman, Qatar, Dubai, etc. Okay, so this video is going to be of helpful to you because we are going to discuss 15 different MCQs in this. 1 to 15 questions we have already discussed in the previous video. In this we are going to discuss 16 to 30 questions. Okay, so in each video 15 questions. And we all know very well that if you are planning to work in any of the Gulf countries, the first step is we need to pass our Prometric exam, which is MCQ, which contains MCQs, that is multiple choice questions and a computer based exam. And these multiple choice questions are asked from all the subjects of all the 4 years that we have studied during our BSc. Okay, so we need to be perfect with our theory as well as practical to crack this exam. So let's get started. Okay, the 16th question that we are going to discuss in this video, first video of this question and 16th question of Prometric series is pap smear test should be done every 1 year, 3 years, 5 years or 6 years, when it should be done. Okay, so as we all know that pap smear is a test which is used to screen for cervical cancer, and gynecologists recommend that pap smear test should be done starting at the age of 21 and it should be repeated every 3 years. The right answer is every 3 years. Okay, so it should be repeated every 3 years for the women in their 20s. Then the next question. An older adult client with a history of blood clots in the emergency room with suspected DVT of the left leg, the nurse starts IV heparin as ordered. Which of the following is least likely to be included in the care plan? The options are ambulation as tolerated, warm moist soaks applied to the affected area, analgesics as ordered, or anti-embolism stockings. Okay, now if you read the question carefully, see, one factor is the patient's age, older patient. Okay, second is history of blood clots, third is DVT, okay, suspected DVT, fourth is the nurse is going to start with IV heparin, that is anticoagulant therapy. So considering all these factors, ambulation as tolerated will be the least is least likely to be entered into the care plan. Okay, that is the right answer. Then next question, breast self examination should be done when? Okay, so the answer is it should be done monthly after the period. So as we all know that breast self examination, the best time is 3 to 5 days after your menstrual cycle. So when the breast is least likely to be tender or swollen. So women after, or girls or ladies, after your menstrual cycle has started, 3 to 5 days after your menstrual cycle has started, you can do your breast self examination in a lying down position and note the breast for any changes in the texture, appearance or color, so that you can detect any breast diseases in an early stage and so that it can be treated promptly. So breast self examination regularly will help to maintain the breast health. Okay, so it's very important for us to do it every month after the period. So it is 3 to 5 days after your menstrual cycle starts. Okay, the next question, mammogram should be done yearly after the age dash. The answer is 40 years. We all know very well that mammogram is an X-ray examination of the breast which is used to detect and diagnose breast diseases, and screening mammogram should be done every year starting at the age of 40 years. Okay, so 40 years is the right answer. The next question, most common cause of death in Saudi Arabia. Okay, as we all know that every country has different causes of death. Okay, we have a standard list, okay, the standard leading causes of death, and in that every country has different causes of death at the top level. So the most common cause of death in Saudi Arabia is cardiac diseases and accidents. So cardiovascular diseases and road injuries are the common cause of death in Saudi Arabia. The next question, a 50-year-old woman post myocardial infarction was admitted in the medical ward. Okay, then a nurse was assigned to look after the patient. The blood pressure is 140 by 80, heart rate is 120, respiratory rate is 22, temperature is 37.5, and oxygen saturation is 95%. So what could be this condition? The options are arrhythmias, endocarditis, cardiac failure, or cardiogenic shock. The answer is arrhythmias. Post myocardial infarction, the patient is likely to go into arrhythmias. So arrhythmias is the right answer. Then the next question. A nurse should assess for hypercalcemia by checking the patient for Chvostek's sign, deep tendon reflex, or Babinski's reflex. What is the right answer? See, Chvostek's sign is seen in hypocalcemia, not in hypercalcemia. Okay, and Babinski reflex, that is again in a different condition. So the right answer is deep tendon reflex. So a nurse should assess the patient for deep tendon reflex in hypercalcemia. Okay, the next question is signs of shock. They have given us two options: increase BP, decrease heart rate. See, actually in the shock we usually notice hypotension, not hypertension. Okay, so there is no chance that the patient will have increased BP, but decreased heart rate can be there. So this can be the right answer. In neurogenic shock you can see bradycardia. Even in hemorrhagic hypovolemic shock you can see initially the patient will have tachycardia, then it is biphasic, then the patient will have bradycardia. Okay, so decreased heart rate is the right answer. The next question, uterus level at 16 week. What is the level of uterus at 16 weeks? See, 16 week, that means the patient is in second trimester. Yes, the pregnant lady is in second trimester. So the level of the uterus, I mean you can feel the fundus at the halfway between symphysis pubis and umbilicus. Okay, so that is the level of uterus at 16 week. Then the next question is, what is the level of uterus at 36 weeks? At 36 weeks the uterus, it reaches the tip of the sternum, that is you can feel it at the xiphoid process. Okay, the fetus is completely grown. Okay, and the fundus you can feel at the xiphoid process. Okay, that is the level of the uterus at 36 weeks. Then the next question, the nurse is using bathe technique to assess a client who recently lost his friend at vehicle accident. Which interview question is most appropriate? So as we all know that bathe technique is nothing but bathe stands for B for background, A for effect, T for trouble, H for handling, E for empathy. This technique was developed by Stuart and Lieberman, and it is a rapid intervention tool for the assessment of psychosocial factor in primary care. So the right question for a person who lost his friend recently in a road traffic accident will be, how are you handling the situation? Okay, so question related to situation would be the best question or the most appropriate question for a person in this situation. Okay, then the next question, the nurse is taking care of a patient with renal colic who received morphine infusion 5 mg per hour and suddenly developed severe shortness of breath, vomiting, changes in the vital signs like heart rate is 120 beats per minute, BP is 88 by 56 and saturation is 88%. So which of the following medication the nurse should consider as an antagonist of morphine overdose? My God, such a big question. They have given the complete situation. In short, this question means what is the antidote for morphine overdose? Yeah, that is the question. So as we all know that morphine is an opioid. Okay, and what can be the antidote for opioid? The options are fentanyl, vitamin K, naloxone or protamine sulfate. So the right answer is naloxone. Okay, we all know very well that naloxone is an antidote for morphine overdose. Naloxone is a opioid antagonist. Okay, and it works by blocking the effect of opioid on the brain to reduce the dangerous symptoms caused by it. Okay, so that is the right answer. So we finished with the 14th question, guys. This is the 15th and the last question of the video that we are going to discuss. So a nurse is caring for a newborn with myelomeningocele. Which of the following intervention should be implemented to prevent injury to the myelomeningocele sac? Keep the newborn warm with a blanket, place the newborn in a prone position, apply dressing with a betadine and saline, or maintain restraints to the newborn's leg, what intervention should we do? First of all, we have to understand what is myelomeningocele, right? Myelomeningocele is nothing but it's a type of spina bifida. Yes, it happens when the baby's backbone does not form normally during the pregnancy. The baby is born with a gap in the bones of the spine. Okay, so there is a sac is formed at the baby's back that contains the part of the spinal cord. So obviously we cannot put the baby in the supine position. So the baby must be placed in the prone position. So this is the intervention. Place the newborn in the prone position. Okay guys, so this is the right answer. So guys, that ends with the 15 questions of this video. Hope you find it helpful. So just go through them again and again. I am sure this will be helpful to you to prepare for your Prometric exam. And if you find it helpful, please do like and share my videos. And if you are new to my channel, please subscribe my channel. So guys, keep studying, keep learning, and help others in understanding. And try your best to be a better human each day. Thank you so much for watching.